Hello, and welcome to Sigma Gamma Rho 22-minute chat sessions. My name is Dr. Camille White. Sigma Gamma Rho is proud to partner with the NIH All of Us Research Program for Precision Medicine. The program is a historic effort to gather data from 1 million persons from diverse backgrounds to accelerate research and improve health. The goal is to find ways to treat and prevent disease in our community. These sessions are meant to provide you with valuable information while navigating the current COVID-19 health crisis. Today, I am pleased to have Soror Faith Foreman-Hays to discuss women's health. Dr. Faith Foreman-Hays is the Assistant Director of the Houston Health Department. She is a seasoned public health practitioner and academician. An expert in public and community health promotion, Dr. Foreman-Hays is also a leader in our sorority. In 2013, she was appointed to lead Sigma Gamma Rho sorority's CDC-funded HIV prevention project, A34 Life, designed to reduce the prevalence of HIV and AIDS in African American and Latinx communities. Currently, she serves as the sorority's National Women's Wellness Liaison. Globally, she leads the city's Changing Diabetes International Initiative aimed at reducing the burden of type 2 diabetes in urban populations. Raised and professionally trained in the city of Houston, Dr. Foreman-Hays is a graduate of the University of Texas School of Public Health and Texas Southern University. She was a National Institutes of Health Fellow and has a license to practice nursing in the state of Texas. Dr. Foreman-Hays has a special passion for eliminating health disparities among marginalized communities and strives to bring social justice and equity to the delivery of preventative health services. Welcome, Soror.
Thank you so much for having me, Dr. White.
So let's talk about women's health.
Okay, this is great. And again, I'm honored to share a bit tonight. I thought I would really frame my talk around inclusion and the importance of women being involved in clinical research and the diversity that's needed. So I'm going to spend my time talking about clinical research inclusion, particularly around women and diverse communities. So I thought I would frame the discussion by just really, we can't talk about something without kind of knowing what it is. And so to kind of set the tone, I wanted to share a little bit about what clinical research actually is. So clinical research really enables researchers and doctors to find a new and better way to understand, detect, control, or treat diseases. A clinical research study is a way to find answers to difficult scientific or health questions. So for example, a clinical study might be conducted to identify what causes people to get a disease or test whether a new treatment or surgical procedure or a lifestyle change can do as far as to prevent a disease before it even starts. So that's really what clinical research is. Now, who can participate in clinical research or in a clinical research study? All clinical research studies have guidelines called inclusion or exclusion criteria that determine who can participate. So these guidelines are based on such factors as age, type of disease, medical history, current medical condition, and exposure history. So these criteria are used to identify appropriate participants and keep them safe as they are participating in research. And they also ensure that the researchers are able to actually answer the questions that they're seeking to find the answers to. Now, why is it important for women, and particularly women of color, to participate in clinical research? Well, I've come up with what I consider 5 reasons why it's important for women to participate in clinical research. Reason number 1, the fact that some groups actually suffer more from certain diseases than other groups do. Yep. So that's reason number 1. So let me back up just a little bit and say this. Most research is done on, I hate to say it this way, but a very narrow population, especially historically. And so when researchers are doing research, they take a small portion of a population, we call it a sample, and they do study on that population. Then their hope is to be able to extrapolate or generalize that information to a bigger population. Well, if we haven't been involved in the study, then it's going to be very difficult for a researcher or scientist to extrapolate and really say that what happened in that study applies to us as women of color. And so that's the reason that research is important all the way around. But the first reason that I wanted to highlight was the fact that some people suffer more from certain diseases than other groups. So, for example, we know that minority groups oftentimes suffer more from maybe a chronic illness such as diabetes, obesity, some of those other chronic illnesses, asthma, there are cardiovascular disease. They suffer from those more than whites oftentimes. And so that presents us with a challenge. So we have to have additional research and participate, because if all of the research is done just on white males, then again, that research cannot, although it has had to in the past, be utilized to provide treatment plans, care plans, medications for the general populations. If we're not included in that, then we have to, accept the research, the data that they have, and we are oftentimes subjected to the clinical care plans and the aspects of care that was normed on that particular population. I'll give an example that most people can relate to, particularly around women, because again, this is about certain communities suffering a little bit more than other communities. But with infant mortality, for example, African American women, more than any other group, when you compare us across groups, we are more likely to die during childbirth, and also our infants are, than any other group. Well, if we don't participate in clinical research studies, then there's no way that we can get at why that is happening. That is also true when you compare African Americans to African women. So there has to be something, again, that may be around us. So participating in a research study will help us to determine whether that is related to social support, some of the other things that the literature has shown, socio-ecological things that are happening around us. So that's reason number one. Some groups suffer more from certain diseases than other groups do. Now, reason number two, the cause of the disease is not the same for all groups. Let me say that again. The cause of disease is not the same for all groups. For example, with heart failure. Well, research shows that heart failure in, for example, Anglo populations is more often due to cardiovascular disease, whereas heart failure in African American communities is more likely due to hypertension, or as we know it, high blood pressure. So because diseases do not emanate or originate, or they're not caused by the same thing across all groups, it's very important that all groups be studied, so that if there is a different cause, you can't give everybody the same treatment, because it's not maybe caused by the same thing. So we have to have participation. We have to have divergence across treatment plans, so that we'll know we need to treat and control hypertension, for example, in African American populations versus cardiovascular disease. Reason number three, medical treatments may not be equally effective for all groups of people. Some groups may experience more side effects from medications than other groups. So that's, again, another reason. That's the third reason we need to participate. I can think back to when I first started my career, I worked in HIV, and we found very early on in the late 80s that some of the HIV and AIDS medication was not actually, it actually had a deleterious effect or a worse effect in African American males than it did in others. So African American males were not able to use a lot of the HIV medications that, we first started out with. Without the research and without clinical research, we never would have found that out, so that we could the scientists could create better medications that were more successful and effective and did not cause harm in African American males. So that's reason number 3. Medical treatments are not equally effective across the board. Reason number 4, individuals with the same racial or ethnic group can respond differently to the same treatment. So when you think about within ethnic groups, for example, like Asians or Latinx communities, and you have women in those groups, just because one treatment may work in one subpopulation may not mean that that treatment will work just because they are in the Asian or Latinx population. So very important to know that all medications don't work for all communities. And so that's a really good reason to participate in research, because we need to be able to know across the board with a variety of different research and study participants how an intervention, a drug, it could even be a lifestyle behavior. For example, in some communities, you can provide one intervention or behavioral modification change, and that may not be something that is culturally relevant. The opportunity may not be there because of a lack of resources or health disparities that exist in that community. And if that is going to be something that community cannot easily adopt or easily adapt into their diet, their exercise habits, then that probably is not going to be successful in that population. So we have to even have divergence in our approaches to behavioral modification. So even within ethnic groups and subpopulations, all treatments cannot be the same. So every treatment is not a panacea, basically a catch-all for treating everything. And then the final reason number 5, and this is one that's close to my heart, because as a breast cancer survivor, it's very important to note that diversity in our genetics, right,
Yes.
is really important to guiding personalized medicine and basing how we take care of someone on their genetics. And in the literature, and we know that African American women are more likely or more often get triple negative than other groups, right? Triple negative breast cancer. And had we not been able to participate in research studies and find that out, look at data, then we would not know how to treat that, how to try to prevent that, to intervene in that. I know that as a breast cancer survivor, and by the way, I'm a 3-year survivor as of February 10th this year. So
Congratulations.
I went to the doctor today. So I had my 6-month checkup, and he's like, hey, 3 years. So important that we are involved in the process so that we now can pick up cancer, we can detect cancer, we can recognize those things earlier, and we can recognize those types and genetic types that are different across different populations. And we can only do this by participating in clinical research studies and programs, clinical trials, so that we can make sure that we're getting the best care that is individually designed for our genetics. And you're not able to do that if you are studying one population and your population is singular, and you're trying to, which we have done historically for years, and that is because we've had low levels of participation for a variety of reasons, for reasons of credibility and trust throughout, the years. But we've had to use treatment plans, we've had to use medications, we've had to use standards of care and practice based on white males, oftentimes, or Anglo males, because that's what we had. And we didn't have women, and we didn't have pregnant women in studies. So we didn't know how hormones would change up, and how lipids and our genetics and all of those things are involved in how you're able to treat something. So very important to know that our genetics matter, and genetics definitely are very important in cancer treatment and cancer prevention and care. So I think that's my 5th reason for why it's very important for women to participate in the process, particularly in clinical studies. I think, just kind of to round it out, it's so important that our community get involved. We have to, I say, overcome we first overcome our issues of trust in the public health system, in research, by acknowledging what has happened in the past, clarifying. We've moved forward because now we have IRBs, which are institutional review boards. We have committees for the protection of human subjects, which have all been born out of the things that have happened in the past. So they should give us some assurance. And I can say, and I feel comfortable saying, that the research that we are doing today has to go through extreme rigor. You can't even get things funded now without having inclusion plans, exclusion plans, and if it does not meet the smell test or pass the muster at NIH and whatever your institution that you may be receiving funds or taking your study through, if it's your academic institution, you will not be funded and you will not be approved to do that research, especially if it's with human and really with animal subjects now. So it's very important that we participate. We have to be a part of the investigation of these things if we're going to benefit fully from the treatments, the medications, the behavioral change, the lifestyle changes, these surgeries that we are being, approved for, being part of every day. And if we're not a part of that process, then, we're kind of, I would say, gambling with research or information that's been normed on someone other than us. So those are, I think, the high points of what I wanted to share about just inclusion and why it's so important for women, and not just women, but people of color in general, to participate in clinical research so that we can be a part of the solutions. And oftentimes participating allows you to help not only yourself, but it allows you to help others as well in the community. So that's a good reason to be included.
Absolutely. You shared some very good information, and one of the barriers to our community is that some folks say that they don't have pertinent information so that they can make pertinent decisions that affect themselves and their family. So what you're saying is certainly going to be appreciated. So let me ask you, what are the benefits that you see from participating in clinical research? You stated quite a few, but are there any others that you want to land on?
Yeah, I think so. I think probably the largest benefit is that you're going to help yourself and others. And I think I kind of finished my chat with that. But I think there are other benefits as well. Sometimes when you participate in a study, you're able to reap the benefits of modifying your own lifestyle. Oftentimes studies have great education, regardless of which group you're in the study, if it's a clinical study, research study. So you benefit from whatever the study offers. So if it offers a lifestyle, for example, if it's a study about smoking behavior or tobacco use, and you're a smoker, you could benefit from some cessation, for example, stop smoking programs or other products that may be available to you. You also may obtain medical care, whereas you before may have had bad, lack of access to care. By participating in a study, you may gain access to medical care and novel, state-of-the-art medical care that, I think about breast cancer, for example. There are some cancers that we know that are what we call metastatic cancers that not necessarily cured, but you can live with them and you can live longer. So there are a lot of studies that you could participate in and get access to very novel, innovative care. So that's definitely a benefit. I think another benefit is that you get to play an active role in your healthcare. You're not a passive passenger in your care. And oftentimes I know that if I wasn't a healthcare provider, I would feel very inadequate. And even going through my process, I felt inadequate at times because even if you're in the field, you don't know everything. And when it comes to your own health, you get really scared and really intimidated when they start throwing around terms from your pathology report and you have a little bit of knowledge and you start diagnosing yourself, and that's not even what it means. So I think you get to be an active participant in your own care, which is always the best position to be in. And then, as I said, you get access to treatments that may not even be out on the market yet, and they may be your miracle. So I think those are some other additional benefits to participating in a clinical research study.
Great. So how does this, you've said a lot, you shared some great information, but overall, how does this impact Black healthcare and the All of Us research program?
I think that overall, it's my hope that by us participating in clinical research studies as a community, we will reduce health disparities and we will improve health outcomes in our community. I think that is the bottom line for all of us as a research program, is we want to reduce and eliminate health disparities, those things that are not equitable, the lack of access to care, the lack of access to consistent and quality care. That is what we want to do. And I think that's why this is very important. If we can eliminate and reduce health disparities, we will definitely increase and improve health outcomes for our community.
Absolutely. Thank you for sharing such great information, Soror. Next, we have a video from the NIH All of Us research program for precision medicine.
We are one nation, one people. When called upon to give from within, we come together and find that our capacity to help others is limitless. What lies inside all of us is more than data. It's life. It's more than insight and medical research. It's vision and honor and compassion. What's flowing through America's veins is its diversity. The next great breakthrough will be found in each and every one of us. And what we find there will unlock mysteries, heal the sick, and eradicate disease. We ask for 1 million individuals to come forward and stand on this landmark in history. All of us are different, and it's those very differences that will lead to answers for generations to come.